Good day, I'm Shahara Reyes, a student nursing in Davao Doctors College from BSN 111I, and today as I'll be assessing the abdomen, but before we start, I'm going to check the client's previous medical record and the doctor's sheet if available, and I'm going to prepare the necessary equipment to be used such as centimeter ruler, marking pen, and a tape measure and a stethoscope. This is to conserve time and energy, and I'm going to perform a hand hygiene to protect myself and my client as well from the cross-contamination of microorganisms. And I'm now going to introduce myself to my client and verify my client's identity by using two identifiers. This is to make sure that I am doing the right procedure to the right patient and explain the procedure to the client and how can he or she can participate the procedure. Good morning, ma'am. My name is Shahara, your student nurse from 7 a.m. until 5 p.m. And can I see your wristband, ma'am? And can you state your complete name?
James.
And your birthday?
April 19, 2004.
Okay, thank you. And what do you want me to call you, ma'am?
Jade.
Okay, thank you, ma'am Jade. So I'm going to assess for your abdomen and check for any alterations and abnormalities. And I'll be inspecting, auscultating, percussing and palpating, and expose some parts of your body that is need to be examined. Will that be alright, ma'am?
Yes.
Okay, thank you. So rest assured that all of the information that will be gathered today is secured and confidential. And as you can observe, ma'am, I'm now closing the curtain and the door for your privacy and ensure your dignity. And do you have questions or clarification, ma'am?
No.
Okay, so I encourage you to go in first so that we'll have a smooth and interrupted assessment. Okay, thank you. And so let's start. So kindly lay back, ma'am, on the bed. Okay, I'm going to put a pillow under your knees so that your abdominal muscle will relax. Okay. I'm going to take this. And now I'm going to expose first your abdomen, but still covering your upper body and your lower body. Okay. So I'm just checking for the vascularity and of the abdominal skin. Any stray or stretch mark, lesions and rashes, and check for the inspect for the umbilicus, the location. Okay, and I'm now going to inspect for the abdominal contour, the symmetry while observing for the palpation. Okay, and I'm now going to assess for going to measure the abdominal girth. Going to use a tape measure. Going to put it in the under the patient's abdomen and round by the stomach. And we're going to start with the umbilicus to check for the enlargement. Okay, I'm going to take this. And next is we're now going to after measuring the abdominal girth I'm now going to assess for the symmetry, and I need you, ma'am, to please raise your head so that I can see the herniation and the diastasis. Okay, thank you. And we're now done for the inspection. And let's now proceed through the auscultation. I'm going to first for the auscultate the bowel movement. And we're gonna need a stethoscope and ensure that when placing our stethoscope in our patient's stomach, the stethoscope is warm. And we're going to start at the right lower quadrant. Okay, and next is I'm now going to auscultate for the vascular sound, the aorta, renal iliac, and the femoral arteries. And I'm going to use the bell. I'm going to use the bell. Okay. And next, I'm now going to auscultate for the venous hump in the mid-sternal lane, in the such as the I'm now going to auscultate for the venous hump in the epigastric area, in the umbilical area. Okay, and next is we're now done for the next is the I'm going to listen auscultate for the friction rub over the liver and spleen. And we're now done for the auscultation. And let's now proceed for the percussion. And let's start with the to percuss the for tone by using the four abdominal quadrant. Okay. And next is we're now going to percuss the span or height of the liver of the by determining the upper and the lower border. I'm going to use the marker. And I'm going to mark it now, okay? And next is I'm going to assess for the descent of the liver. And I need you now to please take a deep breath and hold. And exhale. Okay. And next is I'm now going to percuss the upper border of the liver and start with the upper chest downward. Okay. Let's make this concept a little. Okay, so right here. I'm going to mark it. And next is I'm now going to measure the 2 points. Let's now measure. Okay. And I'm going to repeat the percussion and the mid-sternal lane. Okay. And now is I'm now going to percuss the spleen in the left mid-axillary down. And I need you now, ma'am, to please lay on the other side. Like that. And just going to start with the liver. Okay. And next is percuss the last left interspace. And I need you now, ma'am, to take a deep breath and hold. And mark it. Okay. And you can now lie back, ma'am. And I need you now, ma'am, to please sit down. Going to expose in your back. Going to perform a blunt percussion on the liver. Do you feel pain, ma'am? Okay, so just tell me if you feel pain, okay? And perform a blunt percussion on the spleen. Do you feel pain, ma'am? You feel pain? And next is I'm not going to, you cannot lie back, ma'am. I'm not going to test for the abdominal distension. Going to expose it. So in testing the abdominal distension is we're going to start with the flanks to the umbilical. And mark it till you feel the dullness. And next is we're going to percuss the abdomen. We're going to percuss the abdomen bed upward. And I need you now, ma'am, to please on your side, lay on your side. Okay, and I'm going to start with the flanks to the umbilical. You percuss it. Going to more. Okay. Ito na like that, ma'am. And next is perform the fluid test. And again, ma'am, to put your hand in the center, like this, center of your abdomen. Okay, and just stop in the flanks. Okay, and we're now done for the percussion. Let's now go for the palpation, and I'm going to perform. First is the live palpation. Okay, do you feel pain, ma'am? When I did this? Okay, so just tell me if you feel pain. Okay. Okay, and next is I'm going to perform a deep palpation. I'm going to use both hands. And do you feel pain now? How about this? Okay. Do you feel pain now? Okay. And next is palpate for the muscles. I'm going to use my fingers by the dipping motion. Do you feel pain now? Okay. And next is I'm now going to palpate for the umbilicus and its surrounding. Okay. And next is I'm now going to palpate the aorta by using my both hands. Like this. Okay, and next is I'm now going to palpate by hooking. So just tell me, ma'am, if you feel pain right here, okay? So this one is the hooking, palpating the hooking. And let's now move on for the performing the test of the cholecystitis. Just pressing here in the upper quadrant. You feel pain, ma'am? How about this? Okay. And next is we're now going to palpate the spleen and going to put my hand in the back of my patient, right here, and until you feel the spleen over it. I need you now, ma'am, to take a deep breath. You feel pain, ma'am? Okay, please exhale. Okay, thank you. And next is palpate for the liver. And still going to put my hand in the back of my patient and this. Okay, please inhale now. If you pain. Exhale. And repeat on the other side. So inhale. Exhale. Okay, and after that is next is for the palpate the urinary bladder. Just press it here. Give it pain. Okay, and we're now going to perform the hypersensitivity test. We're going to sharp ruler just to make a line in our patient's abdomen. So just tell me if you feel pain, okay? Okay. And next, we're now going to perform a Episoas sign. And if you naman to please lay on the other side. Okay, we're going to expose this. And we're going to hyperextend the legs. Just tell me ma if you feel pain, okay? How about that? Okay, thank you. And next is perform the test of the obturator sign. And mom, please lay back mom in the bed. Going to support in the ankle and right here. And just repeat it. Do you feel pain, mom? Do you feel pain? Okay, thank you. And next is for the perform the test of the appendicitis. So right here. We're going to use a or both hands. Do you feel pain, mom? Okay, thank you. And we're now done for the assessment of the abdomen. And just going to sum up for the information that been gathered. Okay. So first, you came here because of your abdominal pain, right? With a change in your bowel movement, with your bowel elimination pattern, and upon inspecting your abdomen, your skin is intact, color is consistent and uniform, the temperature is warm to touch, and no vascularities. Your umbilical skin tone is similar to the surrounding skin tones, and it is inverted and round, which is normal. And the abdomen is a bit bloated but normal in shape, and no abdominal enlargement, and no blood sound, and no venous hump or heard when I auscultate, and no friction rub over the liver and spleen, which is also normal. And upon percussion naman, there was a generalized tympany, which predominates over the abdomen, and also normal dullness is overheard in the liver and spleen. And when assessing if the liver doesn't, upon inhalation, the lower body of your lower border of the liver dullness descent from 1 to 4 centimeter below the costal margin. And whereas your liver span at the mid-sternal line, like this here, is in this one, in your mid-sternal line is 6 centimeter, and which is normal. And upon percussion, your spleen, tympany, or your resonance is heard in the last interspace right here. And while your liver and kidney, there was no tenderness or pain elicit for the test of the acids, building flanks, and the distension in the borders between the tympany and dullness remained relatively constant throughout the position changes. And while the fluid test, when you put your hand in the center, as there is no fluid wave transmitted, and upon palpation, when performed the palpation, there is mild tenderness is noted at the deeper structure when I perform the deep palpation, and there is no palpable masses that are present. The umbilical and its surrounding are free of swelling, bulges, or masses, and your liver is not livable, and it has a mild tenderness. And when perform the test of the crucitus in your legs, when I hyperstand that, your legs, there is no tenderness or pain noted, and your spleen is seldom palpable at the left intercostal margin and has no tenderness noted. And the kidney and the bladder are normally not palpable. Also, there is no tenderness or noted. And overall, ma'am, your abdomen is good and normal. And you have questions or clarifications, ma'am? You have questions? Do you have questions, ma'am, or clarification?
No.
Okay. So we're now done for the assessment. Thank you for your cooperation and have a great day. And lastly is perform hand washing.